Hello students, welcome to Microbiology PYQ series. Another very important question which is asked as a LAQ is on Salmonella. You have to write about its morphology, pathogenesis, clinical features and lab diagnosis. So whenever you are writing an LAQ, always write an introduction. So what is the introduction of Salmonella? It is a gram-negative bacillus responsible for enteric fever, basically typhoid fever, and a systematic infection characterized by prolonged fever, abdominal symptoms, and involvement of reticuloendothelial organs. This gives examiner a brief idea that you know in depth about the topic. So even if you are not able to write one or two points later, that will be compensated by your this show of knowledge. What is the morphology? Most of the bacteria causing enteric fever are gram negative. This is a trick to remember. So gram negative. And what does Salmonella do? It spreads. So how would it spread? Because it is motile and non-sporing. So three important characteristics: gram negative bacilli, non-motile and non-sporing. What is the pathogenesis? See, basically what happens that after ingestion through the contaminated food and water, Salmonella reaches the small intestine where it invades epithelial cells and pear patches. You have to write about these two. You cannot write just that it invades the intestine. You have to write small intestine, epithelial cells, intestinal epithelial cells, and pear patches. So what happens is that it survives and multiplies within the macrophages. Generally, what happens is that whenever a bacteria or any microorganisms enters the system, macrophages go and they try to eat and destroy it. But here, it survives the attack of macrophages. It goes and tries inside the macrophages and multiplies inside the macrophages. So you can see how much access Salmonella gets to the body because it multiplies within the macrophages. So wherever the macrophages would travel in the body, they will reach, and that is why they are able to cause systemic infection. Systemic infection simply means they are able to take down one complete system. They are not attacking a particular organ but complete system. So it survives and multiplies within the macrophages, which disseminate the organism via bloodstream, leading to bacteremia and systemic infection. So what happens is that endotoxin, since it is a gram negative, it will always have endotoxin. It releases it leading to fever. There is involvement of reticuloendothelial system as liver and spleen are also affected. And there is systemic dissemination due to survival in macrophages. Systemic dissemination means that they are able to spread all inside the blood. If you will write systemic dissemination, it seems more formal, more book-like. Let's see a simple flowchart where you are able to remember this. First, there's ingestion of contaminated food and water. So then what happens is this Salmonella travels to intestinal epithelial cells and pear patches, where it survives and multiplies in macrophages, leading to bacteremia and dissemination to liver and spleen, where endotoxin is released, which is causing fever. What are the clinical features? You will find a step ladder fever. Step ladder simply means that the fever would increase at definite intervals. Okay, you will not find a shooting fever that suddenly the temperature is on high. The temperature would rise in a step ladder fashion. Since it is attacking the small intestine, there would be abdominal pain. And in general, wherever there is problem in the systemic system, there is diarrhea and constipation. A hallmark feature of this is that there are sometimes rose-looking spots present of abdomen, which give a clear indication that Salmonella infection has taken place. Also, there is splenomegaly. Since it is attacking the reticuloendothelial systems, the spleen would get enlarged. And how would you diagnose Salmonella? Since it is gram negative, so the basic test would be blood culture, which is the most important in early diagnostic test, because what happens practically, you cannot just order the highest test, because it is impractical, it is very expensive, and it is time taking. So culture is a very broad metric on which you can identify. Now what happens is that if the blood culture reports comes positive, a Vidal test is done as a follow-up, which is very effective, but because it detects antibodies. And I think most of you must have done in your lab Vidal test. It is very easy. Now a card comes, you put the sample, you put the buffer. If it is positive, it will show a reaction. And you can also use Typhoid, which is a supportive serological test. What is the conclusion? Salmonella. You have to remember, don't get confused between Salmonella and Shigella. Always remember, what is Salmonella causing? Systemic infection. How? Enterotoxin. And why? Because it is spreading to the bloodstream. And how is it spreading to the bloodstream? Because it survives and multiplies inside the macrophages. So even if you are able to remember this much, you would easily be able to write answer in your examinations. Early diagnosis, very easy, blood culture and Vidal. And even if we need a little more higher test, we can order Typhoid. So I think always depending, and this is a disclaimer I would like to put out. Every university has its standard that a LAQ should be answered in 3 pages, 4 pages. Please expand or subtract according to your university. However, if you write with headings and subheadings and proper nomenclature, the chances of you getting easy marks becomes a lot high. See you in the next topic. Thank